We hope you enjoy listening to this podcast of St. Louis on the Air, brought to you by University College at Washington University. With undergraduate and graduate programs, part-time, evening, and online. University College at Washington University, offering world-class education within reach.
Welcome to St. Louis on the Air. I'm Don Marsh. Today, a subject that's tough to talk about, but that needs our attention regionally and nationally. It's been steadily rising for 2 decades here and elsewhere. In fact, Missouri's suicide rate is higher than the national average. This is National Suicide Prevention Awareness Month, so what can we do to reverse the trend? Joining me in studio to talk about it are Dr. Bart Andrews, Vice President of Telehealth and Home Community Services at the Missouri Department of Mental Health. He's a suicide attempt survivor. Shelby Zurick is Hope After Program Coordinator for Provident, which is a center that provides behavioral health resources and hotline assistance to those in crisis situations. Sergeant Gary Robertson is the Crisis Intervention Team Supervisor with the St. Louis County Police Department. He joins us by phone. Thank you all so much for joining us today.
Thank you, Don.
Shelby, let me begin with you. Do you have any sense as to why the number of suicides has been on the upswing for so many years?
Sure, yeah. That's a good question. It's very complicated to answer. I think that part of it might be related to, people have had speculations about, social media and the impact that could have on suicide rates. As well as, the rise in mental health concerns and more people, are reaching out for help and, expressing mental health concerns, and that could certainly be part of it as well. But it's really hard to answer, and maybe the rates have been higher in the past, but suicide reporting hasn't always been the greatest, and so maybe we're just now hearing about more reported suicides.
I would think the economy, when the economy is bad, maybe that has something to do with it.
Sure,
there could be any number of impulses that would affect
really
it.
Anything that someone perceives as a negative experience, or it could be related to loss, could be a factor that contributes to someone having thoughts of suicide. And certainly with, financial situations, and since 2008, that could certainly have something to do with it as well.
Bart, does it boil down to basically being a mental health issue?
No, absolutely not. And probably one of the biggest myths that we have around suicide is that it is predominantly a mental health issue. Dr. Edwin Schneidman, who founded the American Association of Suicidology and the study of suicidology, in the 80s and 90s really fought this battle that we shouldn't medicalize suicide prevention, but he lost that battle, and it's really unfortunate. Most recent data from the CDC showed that 54% of people who died from suicide did not have a diagnosable or a history of a mental illness, right? So 56%. So we know that mental illness can be a part of someone's suicide crisis. For some people, it can be a driving factor, but for many people, it's not. So we, in this country, we really like, and I think Shelby did a really good job, we like simple explanations. And the truth of the matter is that suicide is what we in the research business call a complex phenomenon. It's actually a complex and emergent phenomenon. Its cause is indeterminate, and there are many pathways to suicide. And so, for an example, the suicide rate was dropping and dropping at a pretty good rate until the late 90s. Into the early 2000s, and then the rate started to increase. Why did the rate start to increase? Well, maybe ask the question, why was it decreasing before then? So we have countries, social media, people talk about social media. There are countries that have extensive social media use in Europe where their social media use and phone use is higher than the U.S. Their suicide rates are decreasing. If social media was causing the suicide rate to increase, we would expect it to increase every place where social media is prevalent. That's simply not the case. So we look for really simple answers. Bullying, you'll hear people talk about bullying. Bullying is not even a very good predictor of suicide behavior. There's a small risk associated with bullying, and that's only by people who label themselves as being bullied. When we actually look at bullying behaviors and experiencing bullying behaviors, it doesn't predict suicide in any way. So our culture really likes these really simple, it's bullying, or it's social media, or it's the economy. All of these things are probably involved in some degree, varying degrees. And also, one of the most important things is it's incredibly individualistic. Every person's suicide crisis is very specific to them. Here's some things we do know. They're almost invariably connected to loss and pain. Those things are pretty consistent across the board, that it's somebody who's experiencing loss and pain related to that loss, but not everybody who experiences loss and pain even has suicidal thoughts, let alone attempt suicide.
Sergeant, how is law enforcement impacted by this?
Well, the calls for service have definitely increased over the last few years, and that's where my unit steps in as the CIT unit, to where we're constantly, looking at the different trends that are out there. What is everybody else doing? And we coordinate with the state CIT council, and we're constantly training and evolving to, really determine, what is the situation at hand, and how can we de-escalate that, and making sure to give this individual that's in crisis, making sure that we can give them all the options and the best options that are out there, to where we can help them and get them into the right resources, such as Provident or BHR.
I want to back up just a little bit to make sure that everybody understands what the work of the crisis intervention team would be. These are specially trained officers who are called upon when someone is acting erratically, basically. Isn't that it?
It's not even just erratically. We might receive a call for service that it could be something as simple as somebody is driving down the street and they see an individual that might appear in crisis. Our dispatchers are also trained in CIT, to where when a call taker is receiving a call from a member of the community, it's their job to, basically determine, does this sound like there's some type of a mental health crisis that's going on? And then the dispatcher has the opportunity to see basically every police officer that is on duty working in that certain area, and they're able to see what their attributes are, and CIT is one of them attributes, to where they can dispatch the closest CIT officer. So with that, it might be something as simple as, an individual that's out, walking down the street that might look like they're in need, or that it could increase all the way to a more severe level, to where this could be a 911 call for service, to where, somebody could actually be actively suicidal and harming themselves.
And then once these people are confronted, what happens then?
Well, basically, all CIT officers, they go through a 40-hour curriculum, which includes mental health and substance use disorders, and we're trained by all the subject matter experts in the area, from the mental health experts, substance use disorder experts, legal experts, family advocates, and other experienced CIT officers. So one of the biggest, some of the biggest tools that we really use on our tool belt is de-escalation and showing empathy, and truly trying to determine what is, what is the underlying factor here, and how can we help, and what is the best resource, and what's the best route to get this individual help.
The two people in studio are nodding with everything that you said here. Any point you want to make with regard to that, Shelby?
Oh, I was going to say that we really appreciate the CIT teams, because, when we have someone who calls in on our crisis line and is in need of immediate assistance, we always suggest a CIT officer go out and talk with this person, because they're trained to work with someone who's experiencing some kind of mental health concern, and they know how to work with that person. And so we always suggest, if you're calling about a loved one, if you're calling into 911, request a CIT officer, because they're the best people to go out and really make a connection with this person.
Is that what the calls you're getting primarily from loved ones who are concerned about someone, or from people who are contemplating suicide themselves?
We have a ton of calls like that, and it seems like that's going up all the time. Having calls from what we call third parties, so someone who is concerned about a loved one, a friend, family member, coworker, who's concerned that this person might be having thoughts of suicide, but just isn't sure how to approach the situation or what kind of help to provide them. So that's a really common call that we have on our crisis lines.
Bart, what would cause someone to make that call? What would they be looking at or looking for to have that concern?
It's a great question, Don. We encourage family members, loved ones, friends to be looking out for changes in their loved one's behavior. Does something feel wrong about what's going on? Now, people often talk about warning signs, and there's an infinite list of warning signs I could give you. Things to really look out for is, does my loved one look like they're in pain? Does it look like they're struggling? Does it look like they're detaching or disengaging? Here's another thing I really like people to watch out for. If someone has been doing poorly for a really long time, really struggling, and all of a sudden there's a sudden change, a positive change, where they were miserable for a long time, and all of a sudden there's this sense of weight that's lifted off them, that can be a warning sign that we watch out for. I think the biggest message that I like to talk about is we should be asking each other, are you okay? How are you doing? And being able to have honest conversations about this. People need to be able to ask, are you thinking about suicide? And I really want to comment, Sergeant Robertson is incredible. I started at Behavioral Health Response 20 years ago, and although we're funded through the Department of Mental Health, I actually work at BHR, I learned how powerful law enforcement is in our suicide prevention efforts, and CIT officers are phenomenal. There are times when no matter how good the folks at Shelby shop or my shop are on the phone or mobile outreach, sometimes we have to call law enforcement, and the law enforcement officers in our community are incredibly good at responding to suicide crises and helping people. We're very blessed in this region to have the level of support we have from law enforcement.
Sergeant, as I understand it, and I know a little about CIT training, that this is relatively new. It's not been around forever, needless to say. But how were these kinds of things handled before CIT became in vogue?
Well, I can tell you that CIT has been in St. Louis County since 2004. It originated out of Memphis, Tennessee in 1988, and it's slowly grown into this phenomenal international program. And Don, the one thing I want your listeners to know, the one important piece to this is not only when it comes to police officers and having an officer respond to the scene, it doesn't even necessarily have to be a CIT officer. And yes, I'm the CIT coordinator, so I'm going to be very pro-CIT and endorsing the program. But just to share with you, out of the near 1,000 commissioned police officers that the St. Louis County Police Department has, nearly 2 years ago, we agreed to become one of the members of the One Mind campaign through Mental Health First Aid. So every commissioned police officer on the entire county police department receives 8 hours of mental health first aid training. So that way, even if you're not a CIT officer, you can recognize that somebody's in crisis and you know how to take the proper steps to de-escalate that situation and show empathy and help this individual. But out of the 1,000 police officers that we have on our department, sir, over half of them are CIT trained. So more than 500 police officers have this additional training. And just, somewhat piggybacking off of what Bart was saying, Missouri is one of the leading states in the entire country. I can tell you that we have more than 9,000 CIT officers in the state of Missouri, and more than 5,000 of those are in St. Louis County.
Well, that's very impressive. I have a follow-up question for you, but I want to invite our listening audience into the conversation as well. If you folks out there have issues that you'd like to talk about with our experts here, give us a call at 382-8255. That's 382-TALK. You can send us an email to talk@stlpublicradio.org, or if you prefer to send a tweet, do so at STL On Air. Sergeant, I want to come back to you quickly because I think all of us are familiar with the term suicide by cop. And I'm wondering if, given the emergence of CIT training here and all over the country, if that has been reduced at all as a result of the interaction between officers and people who may be disturbed.
Well, I can tell you that I actually teach a 2-hour block on suicide by cop in our 8-hour advanced CIT training. And the term of suicide by cop, it really originated back in the late 50s, where a doctor out of Philadelphia was doing some research and was able to determine a certain percentage of these officer-involved shootings were coming from this situation where they were provoking law enforcement to actually put them into this lethal force situation because the individual wanted to die by suicide. Over the last 20 years, I hate to say it, that really social media has definitely blown up this phenomenon by suicide by cop, and there's so many different entities that are out there that have the opportunity to really get this information out there. But it is a growing concern of ours, and it is training that we give our police officers to where we can recognize when we're arriving on scene, or even from the time that we're getting dispatched to a call for service. Does this sound like it could be a situation where an individual is wishing to provoke that lethal response from a police officer. And that's why with St. Louis County, every single police officer is trained in these less lethal techniques, whether it be from the use of a taser or the less lethal shotgun, which is a beanbag round. We all receive training with these less lethal measures, so we're trying to recognize immediately from the 911 call coming in to recognizing that this individual is trying to provoke us, or even a family member will tell us, hey, this individual is saying that they're suicidal and this is what they want law enforcement to do. So immediately when we're going in and we're responding to this situation, we know that we can take the appropriate steps to step back, make sure that we're keeping safe distance, keeping cover, and using the de-escalation techniques that we are teaching all these officers and coming out for a positive outcome.
Shelby, what is it about? I'm not quite sure I understand this. What is it about social media that could be so provocative?
Yeah, well, as Bart said, there's been research into that, but whether we're sure that contributes to suicidal thoughts, not quite positive. But I can tell you, at least on the calls that we get, there are a lot of people who are, expressing thoughts of suicide on social media and, telling people that, something is going on, giving invitations that they're having thoughts of suicide to their friends and followers on social media. So we get a lot of third-party calls from people concerned about a loved one because of what they're posting on social media. But also, we talk about things like bullying on social media, especially with adolescents and whatnot. And so I think there's some thought that could be related to thoughts of suicide, but we don't have very good evidence of that.
Bart, if I may turn to you, you are described as a suicide attempt survivor.
Yeah. Uh-huh.
What was going on in your world when you were going through this?
So for me, I was at a place in my life, I struggle with alcoholism and substance use. I was also a graduate student. I was almost ABD on my doctorate work, so I was almost finished. And I couldn't quite figure out where I belonged in the world. Basically, I couldn't find a way to commit to either lifestyle. Part of, I'll be quite honest, part of my lifestyle was kind of wild and crazy, and part of my lifestyle was very much a dedicated student and young clinician. And I struggled with really severe addiction and alcoholism, which runs through every male through my family as long as I can trace back. And ran into some legal trouble. And while I was under arrest, everything kind of came to a head for me where I couldn't. My version of this has changed over the years. It's been 20 years now, and it's a story that there more and more details emerge. But for me, I couldn't find a way to live in the world without using, and using was killing me. And that moment when I was under arrest and I couldn't run anymore, I made a decision to try to kill myself. Fortunately, and this is one of the reasons that law enforcement is near and dear to my heart, some officers saved my life. Right? Police officers saved my life. And so I'm grateful to law enforcement every single day. And I was really fortunate because that suicide attempt was also the last time I drank. For me, when I stopped drinking, many of the issues in my life resolved themselves. It was not easy. It was a long journey, but for me, I had a simple solution. Not drinking solved a huge chunk of my problems, and I was able to get on with my life. And so I'm one of the folks ever so grateful that I survived, grateful that law enforcement intervened. And I think the important thing, one of the most important things in the story is, as a psychologist, as a licensed professional, it took me 16 years to tell this story. It's really difficult for people, medical professionals, mental health professionals, who the evidence suggests that most of us have experience with mental illness, substance use, or suicide. The majority of us do. But you wouldn't know that because we're afraid to talk about it. And that's because licensure boards and credentialing bodies can often punish professionals for having a history of mental illness or substance use, not even being struggling with an active problem. So part of my goal is to tell my story because there's a lot of us out there.
Yeah. What story do you hear most often, Shelby?
Oh, gosh. We hear, things all across the board. I mean, people are struggling with different things all over the place. And so I wouldn't say that we hear one specific story. We've certainly heard stories of people who are struggling with, alcohol or substance abuse. But we hear, people calling in about interpersonal problems with their relationships, job loss, issues with struggling with their identity, not feeling accepted. So there's no single story that we hear often. I mean, we talk with people about anything in their life that they feel feels a struggle at the time.
I'm going to take a call. Jay has been waiting. He's in Normandy and wants to get into the conversation. So, Jay, you're on the air. Go ahead.
Yes, hi. I was a little surprised that in the intro that you all didn't talk more about why the increase is going on of this. Doesn't it correlate in a big way to the increase of firearms in the general populace? Everybody thinks they need a gun, and I would think that's a big reason. And of course, that's the way that almost always is fatal. So I'm surprised you didn't mention that. And number two, I am curious about what that last lengthy discussion was about the alcohol. So people that abuse alcohol, are they more likely to be in this depressed and suicide state?
We'll get into that. Jay, thanks for the call. Sergeant, let me give the gun question to you. I think we have to point out that maybe the majority of suicides are by gun. Is that correct? Does someone here at the table?
So in the United States of America, a little over 50% of suicide deaths are firearm related.
Okay. Sergeant, what's your reaction to his concern about guns?
Well, I understand that everybody has an opinion about weapons and different firearms and the availability of them. So I definitely don't want to get into that piece on who's allowed a firearm and who's not. But yes, it is one means that is used in suicide attempts, and there's also many other means that people die by suicide. And no matter what, the most important thing for us to remember is firearm, medications, whatever that method might be that individual is thinking about. Really, the keys are we have to get out there to the public that we need to recognize these signs and symptoms, and we can do better by attempting to intervene and get them the help that they need.
Let me turn back to Bart then for the alcohol part of the equation.
So we can talk about both. So there's a lot of different evidence around substance use and suicide. There's definitely a relationship between people struggling with substance use difficulties and suicide. I saw a recent study that showed that particularly binge drinking and drinking before suicide behavior was common, and that binge drinking was a significant risk predictor of suicide behavior. There's a lot of data that suggests that people who are in intense emotional pain are more likely to use substances to alleviate that pain. So we've got this kind of chicken and egg problem going on. So there's no doubt that people who are struggling with substance use are at elevated risk for suicide, just like people with depression are. And one of the things that we do see, one of the interesting phenomena that some research has gotten at, is that when people are using substances and the substances are no longer working for them, when it isn't relieving the pain, that's when suicide risk can really spike. So I've been doing this thing to cope, and now that thing isn't working for me, or it's making life worse. That those are the sorts of things that can really trigger a suicide crisis. And I do want to comment on the gun comment because our listener had a really astute comment. But when we crunch the data and look at the U.S. suicide rise over the last 15, 20 years, the access to weapons hasn't changed in a way that predicts or explains the suicide rate. So yes, guns are a part of suicide fatalities. We know that people are more likely to die if they use a gun as a suicide means, because the fatality rate is the highest of just about any method. But the gun access level has not changed in a way that explains the suicide rate increase that we've experienced. And folks have looked at that pretty close. So guns are involved in our efforts, and we really want to talk about gun safety. That's the real message that we talk about now. When we talk about suicide prevention and guns, we want to emphasize gun safety. This isn't a Second Amendment issue. This is a safety issue. So if people are depressed and a lot of pain and they have access to firearms, well, that's something that we need to be talking about and friends need to be talking about because we really recognize that having a gun around when you're in a really bad place is dangerous.
What about, Shelby, what about young people? We haven't mentioned young people. And they kill themselves as well, and they are big social media users, of course. But are you seeing any kind of an increase at all in young people with these issues?
Sure, yeah. The rates of suicide are going up across the board, even for adolescents, teenagers, young adults as well. And certainly I'm hearing it on the crisis lines, having minors call in, having thoughts of suicide and not being sure what they're supposed to do about it. Who do they talk to? How do they get help? You know, they don't have the ability like adults to go out and get services. So who are they supposed to talk to, and what are they supposed to do when they're feeling that way? So we certainly get lots of calls from minors who are struggling with thoughts of suicide.
What sort of resources are available?
So the typical resources that an adult could use, you know, we can suggest hospitalization if they cannot be safe in any other way. That's kind of a last resort. Getting them access to counseling, getting them set up with adults in their life that are supportive. But to do that, a lot of the times we need to get an adult involved. So really our main priority is how can we talk with this minor about how to get some kind of trusted adult in their life to let them in on what's happening so that they can get access to those resources that we know can be helpful when someone is having thoughts of suicide.
Is the hospital, Bart, the place for them?
No. Oh, no, don't go to the hospital. Let's absolutely have to. Let's talk about that.
Yes.
Now, BHR is very fortunate because with St. Louis City, St. Louis County, St. Charles County, and Franklin County, we have Youth Connection Helpline services dedicated specifically for youth where they can call, they can text, they can chat in to get help. About 30% of our contacts with youth, the youth is dealing with a current suicide crisis. So it's prevalent. It's relatively common in the population calling us. Our goal, and we divert over 95% of our youth away from the hospital. I've got bad news for our listeners. There's no evidence that hospitalization for someone experiencing a suicide crisis actually saves their life. It may make things worse for people for a lot of different reasons. So if we can keep people out of the hospital and get them appropriate outpatient care, get family involved, that's really key. As Shelby hit on a key point, suicide, more and more evidence is pointing out that one of the things that's the most suicide preventive is making sure the person is not dealing with their crisis alone. Getting family involved, getting peers involved. Shelby Shop and BHR use something called collaborative safety planning. Part of the element of collaborative safety planning is getting third parties to speak to us directly and say, hey, this is what's going on with Bob, and we're really worried about him. Can you help us with this? Getting more people involved and getting them linked with appropriate outpatient services. Obviously, if someone can't be kept safe unless they're hospitalized, then we do that, right? But that's actually that's a very small percentage. And unfortunately, one of the problems we have is there's a knee-jerk response by mental health professionals. Here's a little secret for your listeners. Most mental health professionals do not have adequate training in suicide assessment and intervention. It's only required in 10 states that they have any training. Missouri finally just passed a law that said you have to have at least 2 hours of training. That's a great step forward. But the truth is that most mental health providers are not adequately trained, and their knee-jerk response is to send people to the hospital. And then often people end up being admitted, and that's not the best course of treatment, and the research is pretty clear on that.
We're going to have to wrap this up, but I'd like to get a final statement from each of you. Start with you, Sergeant. What's your best advice to people out there who think they might be dealing with a situation, either themselves or a family member or a loved one? What's your best advice?
Just like what Bart was just saying, we have to be able to communicate these issues. If you're a family member or a loved one or a friend, if you think that that close family member or friend is thinking of these thoughts or is in this state of crisis, reach out. You're not alone. Their friends or families. Contact BHR. We have phenomenal programs here at the County Police Department established with the local agencies to where, like Bart was just saying, we don't have to go to the hospital. It's about, even if you have a CIT officer respond to your house, we're going to build that relationship, we're going to build that rapport, and we're going to have that bond, and we're going to do follow-ups with you. And we're going to make sure that you're getting the appropriate help and that you don't feel alone. We're constantly reaching out to BHR. We're having mobile outreach specialists respond to the scene. We're utilizing the iPad program where we're getting a clinician to face-to-face contact with these individuals while we're on the scene with BHR clinicians. There are many steps that are out there. Please, if you think that a family member or friend or loved one is having these thoughts, please reach out. You're not alone. We're here to help.
Shelby, a final thought?
Yeah, I definitely agree with everything he said.
Sure.
I would say if you are concerned that someone in your life is having thoughts of suicide, the first thing to do is ask. Ask them directly if they're having thoughts of suicide. That tells you, how, do I need to help this person right now? And know that you're not alone. You don't have to figure out what to do after that. There are hotlines you can call, and we want to help people figure out how to help their loved ones. But the easiest thing to do is ask them, are you having thoughts of suicide? And that tells you where you should go from there.
Bart, final thought?
If you're out there listening and you're struggling with thoughts of suicide, if you're in a lot of pain, it's important you hear this from all of us. Your pain is real. Your thoughts are real. What you're going through is a real thing, but we don't want you to be alone. We want you to know that there is help available, that you matter, your life matters. So please reach out. We're there.
We are going to put a list of resources on our website today, by the way. So, folks, that's a good place to turn to start if you need to be involved in this process. Pardon me. Bart Andrews, thank you so much for being with us. With the Missouri Department of Health, Shelby Zurick is Hope After Program Coordinator for Provident, and Sergeant Gary Robertson with the St. Louis County Police Department. Thank you, sir, for being with us.
I appreciate it.
This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.